Merci beaucoup. So I'm presenting in the interventional research part of the day, but I have no solution and no intervention, and I'm presenting on something I don't it's something new to me, so bear with me. I'll try to make sense of it. I wanted to speak to you about moral distress experienced by vaccine immunizer during the COVID pandemic, but also in other routine vaccination, and showcase some preliminary research on a study that we did last year. So let me start by defining a bit of the scope of what I'm going to present. So when you're an healthcare provider, you could face different moral stressors that have been framed around like 4 type of stressor, moral constraint, whether you're able or not to perform what you think is the moral correct action, moral uncertainty, if you're not sure about the right thing to do, moral dilemma. There's 2 ethically acceptable options, and you need to choose between these 2. And moral tension to reflect that you're unable to share your belief with your colleagues. So healthcare provider can face different moral stressor as part of their work. When there's a sustained moral stressor, you can start to experience moral distress, which has been defined as a feeling of unease stemming from situation where institutionally required behavior does not align with your moral principle. And when there's too much moral distress, it could lead to moral injury that to reflect the longer-term moral harm that are experienced. So this concept of moral distress was developed in the nursing literature, but it was applied to different type of healthcare provider, and it was also used to measure how other professions were doing. And it's been linked to sustained mental health issue, but also burnout and staff turnover. So we know how thin are the resources in the healthcare system, so anything that could lead to people leaving the profession is something that we need to take into consideration. There's been also many studies showing that there's some gender difference in the experience of moral distress, with women being more prone to report and experience moral distress, but there's also intersection of different social positions that could lead to increased moral distress as well. People in racialized and ethical different ethnic difference have been shown as well to be different in the level of moral distress. That being said, this is quite a new topic, and there's no scientific consensus on what is exactly moral distress, how to operationalize it, and how to measure it. And it's not included in the DSM-5, so it's not a mental condition similar to burnout. So that being said, what happened during the pandemic, and I put a post on X by colleagues from the Ottawa Public Health issue. It's quite funny, in fact, when you read it, but it's also a bit distressing because it shows how online harassment was so intense during the pandemic that it was difficult for public health practitioners to discuss about anything related to the pandemic, any measure, because they were facing huge hate. And of course, when we look at moral distress during the pandemic, we all know the intense increased workload experienced by healthcare provider. In Canada, they were lacking PPE, so they needed to treat patients with an unknown virus without mask and gloves and stuff like that. And there were changing guidelines. So at one point, masks were not recommended, was not useful, but when you're trained in healthcare, you know that for a respiratory virus, a mask is still something good to wear. But because there were no masks, it was not effective. So, all those tension created as a really stressful environment. In addition to lockdown, school closure, daycare closure, in Canada, there were pretty long period where the society was pretty much closed. So for people working in the healthcare, especially for women, you still needed to take care of your child, manage to do homeschooling, and still go to work. We also in Quebec had the highest number of cases in long-term care facilities, and in these facilities, most of the staff are migrant workers, agency worker with lots of turnaround, so that these are precarious workers that are more prone to be experiencing moral distress as well. And of course, the vaccination context was really, really intense in Canada. It was the first time during COVID where there was mandatory vaccination, and there was a lot of protests. I've put some picture of the Liberty Convoy. This was a protest led by truckers that all went down in Ottawa in front of the Parliament to oppose, and they were protesting against everything, but it was mostly framed around COVID mandates, and they were feeling that Canada was becoming a dictature, and they were baiting in spas in front of the Parliament, so it was quite funny to have this level of liberty of expression, but still feel you're being into a dictatorship. So during the pandemic context, there was a huge increase in different studies conducted to measure moral injuries, but there was nothing specific to immunization and moral distress or moral injuries experienced by vaccine providers. So we did an online survey to measure moral distress, and we target all healthcare professionals that have been involved in COVID-19 immunization campaign, whether in public health or directly providing the vaccine. We had different questions. We did use the Pro-VCB, but also work satisfaction, and a scale to measure moral distress. It was a small exploratory study, so we did mostly passive recruitment, but we sent out invite to participate in unions, but also through ads in Facebook and on some association around immunization in Canada. To measure moral distress, we use a validated scale that is called the Moral Distress for Healthcare Professionals. It's a 27-item scale that target the key feature of moral distress at 3 levels, so patient, unit, and system level distress. And all of those items are measured on 2 dimensions, whether you have faced that issue and how distressful it was for you. And then you need to score those to create a composite score that could range between 0 to 16 per item, and then you add all those different scores to do a composite score that range between 0 and 432. So could have put that on a 0 to 100 scale, but we did use the validated approach by these authors. So some of the findings, we only had 141 respondents. As I said, it was a small exploratory study, mostly nurse, which is not bad, as in Canada, nurses are the provider that do provide vaccination in public health, but also in private setting. So this is the profession most involved in vaccination, and for colleagues in France, nurses can prescribe and administer vaccine by themselves without being supervised by a GP. And many were quite experienced, so 3/4 had worked within immunization for more than 15 years. And we didn't get that representative of a sample, but most of our respondents were from Quebec and Ontario. So these are the answer to Pro-VCB items. the attitudes toward vaccination were quite positive, but I must say a bit less positive than what we used to see when we do survey with immunizers. We usually see 90% and above for most of those items. So we had like 84% of nurses involved in vaccination thinking vaccines are safe is a bit low in my view, looking at other studies done in Canada. These are other items from the ProVCB as well. 2/3 were in favor of mandatory COVID vaccination for healthcare providers. And there was some, and maybe Pierre could comment in the discussion period, there was some item that I would have expected difference between making sure their patient have received all recommended vaccine and an openness to, patient with given information and letting patient choose. I thought that there should be difference, but maybe I'm wrong. And 86% felt competent to be able to talk with vaccine hesitant parents, and that's not unusual because in Quebec, where most of our participants were from, most nurses are trained in motivational interviewing as part of their different roles. Work-life satisfaction, so not that bad, around 20 to 30% at some level of unsatisfaction regarding different conditions. The main unsatisfaction was around salary, which is not surprising. So these are some of the items of the moral distress scale. So the mean score was 76. Remember that it's between 0 and 432, so that's relatively low. And the range per participant was between 2 and 328. So I won't go through all those items because that's a pretty long list. But these are the items with the lowest score, and they were all related to caring decision, ethical dilemma around caring decision, which makes sense because these were mostly vaccine providers. So you're vaccinating people coming into the mass campaign, there's less of those difficult decisions to make. And these are the items with the highest score for moral distress. And these are related to availability of resource, support from management, and administrative workload. So the burden of doing admin tasks was something that created a bit of a distress. And we also had an open-ended question to ask for other source of moral distress, and it's interesting to see that there's some that mention fear of losing their job because they were unvaccinated themselves, but also like the anger that people had when they came to the clinic to get their vaccination, the death threats, there were protests in front of clinics, in front of hospital. That was difficult to bear for the people that were going to immunize in those clinics. And there's also a quote around the extra burden of the lockdown and having to work in healthcare. That's an interesting slide. We had a glitch with our survey. It was an online survey, and for the first half, the question didn't appear. So it unfortunately not that but we fixed it at some point. But we asked people if they were considering to leave the profession due to moral distress, and it's more than half that did at some point consider leaving it, and 30% that did leave the profession. And that, because it was all framed around immunization, that might just implies that they stopped being involved in immunization and kept their job as a nurse, for instance. We also asked whether people experience abusive behavior by patients during the act of vaccination, so during the immunization act. 30% said yes, often or very often, or experience abusive behavior during a conversation with patient, and it's 24%. So it's something that was not unusual to be facing. Again, this was these questions were asked to the all samples. So 43% consider leaving the profession within a year, and almost half consider that their work condition has worsened since the pandemic. We specifically ask about stopping to be involved in immunization, and it's a third that are either not discussing vaccine anymore, not giving vaccine anymore, or not involved in immunization at all. So to conclude, I think these preliminary data show that there's something to be understood with moral distress and immunization. It's an under-researched topic compared to moral distress and other type of work or other activities. We need to think about that to protect the workforce. I've been doing interview with nurses. Vaccination is not something that they're really appealing for nurses. They usually prefer to do other type of preventive act and are less willing to be part of immunization. So for those who are already in the job, we need to make sure that they're protected, that their moral distress is addressed. And because of that, we're launching a larger survey with interviews to better understand the situation. And the moral distress scale was validated, but it was less adapted for immunization. So we've developed and tailored a specific scale targeting immunization behavior to have a better understanding. Because we think that maybe there will be still issues around moral distress in the future. One of our prime minister used to say that we're a mouse sleeping near an elephant. When the elephant moves in the bed, we also feel it in Canada. So given the political situation, there might be future outbreaks, but there might be also we feel an increase in polarization around vaccination and a decomplexified attitude or a decomplexified opposition to vaccination that could impact those that are giving the needle. And I didn't want to finish with a depressing cartoon, so I know everyone knows the famous Trump ad, Make America Great Again, but now we have our own Canadian ad from Doug Ford, the Prime Minister of Ontario, saying Canada is not for sale. And I also wanted to plug a session that I will be convening in the next Sociological Association conference on misinformation and vaccination. So I invite you to submit your abstract by the end of next week. And that's it.
Thank you very much, Eve, for this presentation. Any questions? Cathy.
Sorry, the enthusiastic Australian. Thank you, Eve. That was really interesting. In the work I've been doing, looking at the impact of COVID vaccine mandates on various people involved in them, I've been talking to people who've been sort of managing vaccination programs for COVID-19 in various states in Australia and in various countries in Europe. One of the things that's been really interesting to hear about is this specific issue of consent and people kind of turning up and saying that, well, I'm here and I'm getting the vaccine and, but I'm not consenting, and sort of these navigation, how, what is consent? And so I'm thinking about that as a particular type of moral distress that there might be for the vaccinator. But I guess my question in particular around all of that is, in your more expansive work that's building on the exploratory work you've talked about, is there a way of differentiating clearly when the moral distress is arising from coercion, like coercive policy, like a mandate, as opposed to all the other things. Because in a lot of the results you presented, it could just be that this is an aggro person who's just like horrible to deal with, and not necessarily reacting to the fact that they're having to be vaccinated when they don't want to be. So I'd love to hear a bit more about that.
Yeah, and I haven't present, but we've done lots of interviews with immunizers in Quebec around the vaccine passport. And because, teenagers were required to have a proof of vaccination to do sports and so there was a lot of people that didn't want the vaccine, but they were just coming to keep their social activities. So and they were violent behavior within clinics, people being aggressive, needing security because people were shouting. If you're against vaccination, you don't go to a clinic usually. But those people felt forced, and then so that created a space for more increased moral distress. But because our scale was so generic, we're unable to tackle whether that was the case. So we're doing this other study just to have a better understanding of the specific context of COVID-19 vaccination compared to other routine vaccine where people are at least showing some openness when you're going to the clinic or you're seeing your GP for something else.
Thank you.
Down? You have? Okay. No, women first.
Oh, a bit of privilege. Thank you. That was really fascinating. It's not a topic I've any experience with, but I wondered if you were planning to analyse, for example, if health professionals' own confidence in vaccines, such as their ProV-CBE score, is protective against the negative impacts of moral injury, moral distress, such as wanting to leave the profession.
Yeah, exactly. That's something that we want to, some analysis that unfortunately haven't done yet, but we want to run because there was also huge involvement of different workers because the campaign was so massive that they hire anyone that could be qualified to give the vaccine. Those people haven't had any training and they're not used to immunization. So we want to see if there's some difference around that, because I would suspect that those that are more confident themselves would be less disappointed by those issues.
Leonard.
Yeah, thank you very much for your great presentation. We've been working on unspoken vaccine hesitancy among healthcare workers. So in Belgium, for instance, we realized we had issues inviting healthcare workers to public discussions on vaccines, and then a lot of them did not want to voice their concerns and so on, and we had a specific project on that. What we found is that among those who experience unspoken vaccine hesitancy, it kind of falls into the definition that you noted of moral tension, right? The inability to discuss with others or to voice their concerns. And so some of our participants were under, antidepressants, or they were leaving their jobs, or they were having a double speak, trying to guess if the colleague is a bit pro-vax or not, and same with the patients. Some were trying to refuse to talk to patients about vaccination. And so I was wondering if you had more results on this particular, the moral tension bit.
Great point. We do not have in this study, but we will ask in the next one. And there was some discussion at one point in Quebec to have a mandatory vaccination for healthcare worker, and it was either you're vaccinated or if you're not, you're losing your job. And that created so much tension within units. And we often talk about those vaccine hesitant providers, but we don't often talk about the two pro healthcare provider that are maybe pushing too much, lacking respect for their colleagues that are unvaccinated, and shutting all those discussions. If you're You know, there was this word in Quebec, COVIDio, that was applied that if you're not vaccinated, you're just an idiot, you don't understand anything. That shut down any like legitimate concern about vaccine that you could solve if you were able to discuss this freely. And there was some unit when people stopped talking to each other, like huge dramatic consequences. And there were people that were afraid and thinking that, oh, my unvaccinated colleague put me at risk and is a danger to me. So it's already a tough job. So even with that, it's even worse. But it's, how do we cope from that and move on? And now it's like the pandemic's over. We don't talk about it anymore, and we're just trying to forget. And there's no like healing process for public health practitioner as well. It was really tough, and it's like we're now moving to the next one and preparing for H5N1, and yeah.
Thank you.
Other questions? I have a small one. It's just a suggestion. Yeah, yes, I can do it. Did you envision for your next study to add also a kind of group of questions about the emotions?
No, I didn't thought about it, but that's a great suggestion. Do you have any like item suggestion based on your qualitative?
Yes, you could use our qualitative study. Leonard works on emotions also, which are expressed online in social media, and he has also an approach to find I would say a taxonomy, a kind of taxonomy of emotions. And we are planning with Jeremy a study which will start in a few days among the population to document the extent to which people felt emotion during a vaccination consultation in the last month. So we will have many results to share, and it would be very interesting to see what is the place of emotions, for example, in a mediational analysis. After perhaps stress, what are the causes, what are the factors which favor as the expression of emotions during a consultation, for example?
Yep.
Oh,
Would
okay.
be great. Yeah.
Just wanted to say we have colleagues in Finland from Jitsuvax who have also
Yes.
looked at this with health professionals, and they have some data.
Great. That's why I came here, just to have all this
Yes,
knowledge.
yes. Everything is okay. So if there is no other questions, I shall very solemnly say that this morning is finished, and you can have lunch now in the other room, not far from here. So I thank all the speakers and the participants for their questions and the speakers for their presentation. This was absolutely passionating, but this is not finished, and I wish you a very good lunch.